Mr. Speaker, I rise today to provide this Honorable House and the public with an update on the work undertaken and the progress made to date to strengthen Bermuda's health system. Bermuda's health system needs strengthening to ensure that all residents can access affordable and essential health care services that are delivered effectively and efficiently. The results will include improved patient experiences and health outcomes and a decreased economic burden overall. Mr. Speaker, the Bermuda Health Strategy 2022 to 2027 supports the core visions of healthy people and healthy communities and sets out 8 strategic principles that are intended to set us on a new path towards the equitable, accessible, and sustainable health system for the island. These 8 principles, Mr. Speaker, are as follows. 1, promoting healthy living and preventative care. 2, focusing on person-centered care. 3, understanding our population's health needs. 4, providing access to health care coverage. 5, strengthening our healthcare workforce. 6, harnessing healthcare technology. 7, partnership and collaborative working. And 8, preventing wasteful care and promoting efficiency. Mr. Speaker, achieving a stronger, more sustainable health system requires us to progress all 8 strategic principles, and I'm pleased today to report on the progress made to date. First, Principle 1, promoting healthy living and preventative care. Mr. Speaker, we know that health promotion and disease prevention are essential ingredients in building a more robust health system and a healthier population. Many of the chronic illnesses impacting our community and placing a heavy burden on our healthcare resources are strongly related to lifestyle factors such as poor diet, physical inactivity, and smoking. We understand that more must be done to empower and support people to lead healthy lifestyles, and we will do just that. Mr. Speaker, it is important to note that the emphasis on health promotion includes mental health as well. There is a recognized need to challenge historical stigma and preconceptions about mental health. Good physical and mental health are collectively a part of our efforts to promote wellness and healthier living. For 2023-24, the Department of Health's Health Promotion Unit received additional funding for implementing the HEARTS program and new health promotion and wellness initiatives, as well as facilitation of the mental health first aid training, and this is just the start. Mr. Speaker, the 2nd and 7th strategic principles are focusing on person-centered care and partnerships and collaborative working are encapsulated in work undertaken by the Bermuda Hospitals Board, the Bermuda Cancer and Health Center, and now the Ministry of Health to develop integrated care pathways that map the journey of a patient's and services providers along different healthcare tracks. Integrated care pathways set out in detail the essential care steps for people with specific needs from the viewpoints of the patient and their families and the care provider. The care journey, Mr. Speaker, is mapped from beginning to end. It defines what happens when and who is responsible at any stage along the journey. The BHB has developed care pathways for breast cancer, prostate cancer, and end-of-life care, working with the Bermuda Cancer and Health Center, as well as others. The ministry engaged KPMG to work with patients and care providers to develop integrated care pathways for the first 1,000 days of life, chronic kidney disease, and acute adult mental health. Approximately 1,135 stakeholders were directly engaged within these 3 care pathway initiatives. This included 751 residents who responded to the 3 community surveys and approximately 255 patients, health service providers, and other health stakeholders who participated in workshops and one-on-one interviews. And this is an excellent example of the level of collaboration and diversity of stakeholder voices that we are seeking to include as we continue to work on generating solutions to strengthen Bermuda's health system. Mr. Speaker, the purpose of collaboratively developing these care pathways, and in particular including both patients and service providers in the exercise, is to identify gaps and/or fragmentation in care and seize opportunities to improve coordination of and reduce duplication in services. In this regard, having a person-focused approach is critical to capturing all elements of the care journey. Mr. Speaker, the patient's care journey provides the patient and family viewpoints, while the service map reflects what each clinician does. These two elements of the care journey together inform the solutions for the integrated care pathway result. With this more comprehensive information available, healthcare providers can implement changes in the care journey that improve the experience of the individual receiving the care and, most importantly, improve health outcomes. The integrated care pathway for acute adult mental health has been completed, while the final drafts of the first 1,000 days of life and chronic kidney disease are the subject of final reviews. Mr. Speaker, we have also made progress in principle number 3, understanding our population's health needs, and that's another strategic principle, Mr. Speaker. Last year, I reported to this Honorable House that the Ministry would undertake an assessment of our population's health needs to better manage health systems, strengthening giving the island's financial constraints. We need to understand our priority health needs to properly align our efforts to sustainability, improve, and the health of the people of Bermuda. Mr. Speaker, I'm pleased to inform you that with the support of the Public Health Registrar, with the UK Health Security Agency, and the UK Overseas Territories team at the Department of Health and Social Care in London, along with resources kindly provided by the Department of Statistics, public health professionals, epidemiologists, health promotion professionals, and representatives from the Bermuda Health Council, Bermuda's first Joint Strategic Needs Assessment, or JSNA, is complete and has served to provide the strategically critical baseline of information. Analyzing the best data currently available through the JSNA sought to understand the health needs of Bermuda by considering Bermuda's population profile and the social determinants of health, our health behavior and risk factors, the causes of ill health and death, the specialized needs of vulnerable groups, including children, the elderly, and people with disabilities, and the current state of our healthcare services. It is a foundational piece of work that brings together the many factors impacting our health care, and health system in one document. Mr. Speaker, honorable members will know that it is not just medical care that influences our health. Social and economic conditions, including our housing, work, education, and local community networks, are important factors that define our health. And these are the factors, Mr. Speaker, known as the social determinants of health. By understanding this comprehensiveness needs assessment using the concept of the social determinants of health, which is more holistic approach, the Joint Strategic Needs Assessment is a report that can be used by the whole of government and civil society to develop actions to protect and promote health in various settings, whether in the classroom, the workplace, or local community settings where people live and recreate. Mr. Speaker, the JSNA will be made available and downloaded on www.healthstrategy.bm. Mr. Speaker, some of the JSNA recommendations include the following: developing strong and linked health information at an individual level, developing a model of health and social care focused on care of the elderly, focusing on social determinants of health rather than just health care, developing payment mechanisms for clinicians involved in healthcare quality improvement and health system strengthening where improvement in outcomes can be demonstrated, improving the quality of domestic incident reporting systems, and incentivizing the provisions of smoking prevention and cessation services. There are 24 recommendations in total, Mr. Speaker, and a number of which are beyond the remit of the Ministry of Health, and several of which are being worked on by different government departments and agencies already. The decision to enlarge the assessment to include the social determinants of health contributed to recommendations that are wide-ranging and are also reflective of the existence and the extensive needs of the population. Mr. Speaker, the Ministry intends to undertake another joint strategic needs assessment in 5 years. Mr. Speaker, with respect to strategic principle number 6, harnessing healthcare technology, on this point, honorable members will recall the government's commitment to developing a national digital health strategy. And I can inform this House that the first draft of the National Digital Health Strategy is also largely complete. In undertaking the exercise of developing the National Digital Health Strategy, an interdisciplinary working group of health and technology professionals from the public and private sectors was set up in October of 2022. And their work resulted in the development of 15 strategic recommendations that lay out a holistic approach to implementing a national digital health system in Bermuda. Digital health, Mr. Speaker, is defined as embracing the integration of technology, people, and systems to organize and deliver healthcare services and data efficiently. The strategy outlines a best practice approach to ensuring digital health can become a reality and that members of our community can benefit from the enhanced care that is possible through this level of integration. This would include residents having online access to their health records through patient portals, practitioners being able to better coordinate care with more immediate access to test results and the input of other professionals on the treatment team, and a reduction of duplicate lab tests and scans, thus reducing waste and inefficiency. Ultimately, Mr. Speaker, the National Digital Health Strategy seeks to integrate efficiency and cost effectiveness into the healthcare system while tackling the current burden of health expenses and the fragmented nature of the healthcare delivery in Bermuda. And yes, it is intended to support the delivery of universal health coverage. Mr. Speaker, this is a multi-year effort, and I look forward to sharing the full report in the coming weeks. Mr. Speaker, with the Joint Strategic Needs Assessment and the National Digital Health Strategy completed, the Ministry has established Bermuda's baseline for health system metrics. The purpose is to provide a set of metrics that will enhance our understanding of health system outcomes. These metrics will inform decision-making as we seek to improve healthcare delivery at the national level. A core working group of key stakeholders in public health and the private sector reviewed existing health system metrics available for inclusion as a starting point. The process is brought together in one place, health system information from a variety of data sets. Selected health system metrics include health expenditure per capita, out-of-pocket health expenditure, life expectancy at birth, infant mortality rate, number of nurses by population, average length of hospital stay, avoidable mortality, and emergency department visits based on the severity and intensity of patient care episodes. Mr. Speaker, this first set of baseline health system metrics contains the metrics that are available in the short term. A task and finish group will identify and prioritize future key metrics. Moving forward, as the National Digital Health Strategy is implemented and impacts the secure collection of health data, additional health metrics can become available and be collected more efficiently. Presently, the Ministry is working to create a public dashboard to display the baseline health system metrics that are already collected. Mr. Speaker, an additional project embarked upon this year is the merger of the government funds. This is linked to strategic principle number 8, preventing wasteful care and promoting efficiency. As stated in the Bermuda Health Strategy 2022-2027, the health need is for the government to realize opportunities to ensure the future sustainability of health care in Bermuda, and this includes assessing the sources and uses of all of the government's health funds. The Ministry is currently reviewing the options for optimization, recognizing that reforms of overall health system financing is the larger project. Mr. Speaker, as honorable members can see, the Bermuda Health Strategy 2022-2027 is not a document that is sitting on a shelf gathering dust. The strategic principles contained within it guide the work of the Ministry, and collectively following through with them puts us on the path to strengthening our health system. The one strategic principle yet to be advanced is principle number 5, strengthening our healthcare workforce, and this will be included in the upcoming projects. While all the strategic principles are important, Mr. Speaker, principle number 4, providing access to health care coverage, in other words, universal health coverage, remains a fundamental principle that I would like to turn to now as part of this comprehensive update. As I do so, you will see that the strategic principles, whilst listed separately in the health strategy, do overlap in their contribution to health system improvement. Mr. Speaker, the Ministry of Health has spent the past year completing the setup of the transitional governance structure needed to develop and manage the implementation of universal health coverage. The vision of universal health coverage, or UHC, Mr. Speaker, is to ensure that all Bermuda residents have equitable access to quality care without suffering financial hardship when paying for these services and critical medicines. Mr. Speaker, as previously reported, the UHC governance structure includes the UHC Steering Committee, which is chaired by the Chief Strategy Officer, reporting to me as the Minister of Health. It is important to note that the UHC Steering Committee has been fully engaged and at work for the past 2 years. In addition to the UHC Steering Committee, Mr. Speaker, there are 5 health forums that also comprise the UHC governance structure. And the health forums represent the many stakeholders involved in the health system, including patients, providers, which includes a range of health businesses such as physicians, nurses, labs, physiotherapists, pharmacists, and others, the payers, which are the employers, regulators, and community organizations such as the nonprofits and the unions. The role of the forums is to provide insight, feedback, and recommendations to the UHC Steering Committee from their various areas of expertise and/or experiences. The Ministry of Health's Program Management Office executes UHC projects and supports the forums and the UHC Steering Committee. Mr. Speaker, the first of the forums, which is the Clinical Senate, has been meeting monthly since January. The Clinical Senate is comprised of a multidisciplinary group of over 50 health service providers who provide professional clinical advice and recommendations to the Ministry of Health for its further consideration and decision-making for the Universal Health Coverage Program. For the remainder of the forums, health financing, health insurers, health advocacy, and service providers, a wide range of health system stakeholders have been invited to participate, and meetings will begin next month. I want to take this opportunity to thank the chairs and deputy chairs of the various health forums for their work so far and the work to come. Their experience and contributions will be invaluable for strengthening Bermuda's health system. Mr. Speaker, the setting up of the Program Management Office is moving forward as well. In addition to project managers who previously consulted with the Ministry of Health, 3 new temporary additional posts were approved, 1 for the UHC Program Director and 2 for additional project managers. The Ministry of Health is well aware of the public's desire to know what is next and when will UHC be a reality. As work on the initial projects that I've just shared with you has ended, the UHC Steering Committee, with the support of the Program Management Office, looked ahead to the next steps of the journey to universal health coverage for all residents. Mr. Speaker, the recommendations arising from the first set of projects gave birth to a list of approximately 64 new projects, many of which carry on from these initial projects and initiatives. And the next phase of work is grouped into 8 health initiatives or major projects, and they are as follows, Mr. Speaker: healthcare modeling, national digital health strategy implementation planning, national health system metrics, national health system standards, UHC core health services, the implementation of completed integrated care pathways, and the beginning of the process for new care pathways, health regulation, and healthcare workforce strategy. You will note the inclusion of initiatives such as the National Digital Health Strategy, Integrated Care Pathways, and others previously reported on. Mr. Speaker, the inclusion of such initiatives represents the second phase of work coming out of the initial findings and recommendations of the first phase. Mr. Speaker, healthcare modeling involves understanding Bermuda's current and future healthcare costs, services, and population needs, including future utilization of care services on and off the island. Healthcare modeling also includes developing options for more effective health system financing based on current and projected needs. Phase 2 of the National Digital Health Strategy Initiative will entail setting up an appropriate governance structure and developing an implementation plan to begin to integrate data across the health sector into a centralized system, making patient-level health data more available and enable better reporting across the system. Mr. Speaker, this should ultimately improve the overall quality of care and health outcomes of patients. The National Health System Metrics Project will continue with identifying the metrics needed for the UHC program, as well as the measures most needed or desired by the community. National Health System Standards will involve determining the relevant data standards for Bermuda and developing an implementation plan for those health data standards. This is linked, Mr. Speaker, to the need to improve the coding of healthcare services and procedures in health records. The data we can retrieve from health records is only as good as the data that was input. Both health system metrics and health system standards are part of the larger National Digital Health Strategy. UHC Core Health Services refers to developing the list of core health services that should be part of the UHC Core Benefits Package. An essential part of the assessment of the core health services centers on the learning that has come about from the integrated care pathways. The next phase of work will comprise implementation plans based on the recommendations from the completed pathways and undertaking new care pathways. Health regulations are identified as a project, as they will be the subject of ongoing updates on an as-needed basis. And finally, Mr. Speaker, developing a health care workforce strategy is extremely important, particularly with the intense competition for healthcare professionals and the lack of health care givers across the health system. Our population is aging, which brings with it particular care needs that must be taken into account. Overall, having a strong health care workforce is essential for delivering on our commitment to strengthening our health system. Mr. Speaker, the Ministry and UHC Steering Committee are of the view that if sufficient resources are in place, resources that are both internal and external to the Ministry, then we can plan and aim for the following milestones. April 2024. Define the core health care services to be included in the benefits package for all residents. April 2024, understand the demand and cost to deliver the core care services and develop payment model options for the core care services, as well as consider wider health system financing. July 2024, undertake financial analysis to baseline and then model options for the core care benefits package. Also evaluate the economic impact of the options. September 2024, recommend to Cabinet the most suitable and sustainable options enabling delivery of the core care benefits package, ensuring cost meets resources, both system and individual. And April 2025, adopt a phased approach to implementing the core care benefits package, starting with the basic core benefits for all. Mr. Speaker, honorable members will recall the initial roadmap to achieve universal health coverage proposed that Bermuda adopt an approach comprising a thin level of coverage for everyone. And from there, additional health care services would be built out and added unto the core care benefits package is complete. Mr. Speaker, this is the approach the Ministry continues to advocate for, recognizing that over time, benefits will adjust in accordance with what our population health needs. Mr. Speaker, the above list of milestones represents a very ambitious timetable, and it will be reviewed and reprioritized as necessary. However, this government continues with its commitment to universal health coverage to ensure that all Bermuda residents have access to essential, quality health services when they need them without suffering financial hardship. We look forward to working collaboratively and constructively with the UHC Steering Committee, the health forums, and the many health system stakeholders to achieve the goal of universal health coverage and improved health outcomes for our residents within a strong, sustainable health system.